This is Snowflake Intelligence, a conversational AI layer built directly on top of your live Snowflake data. Here we're working inside a patient's management context, where all patient records, insurance contracts, and service catalogs are connected and ready to query. No dashboards to configure, no SQL to write. You simply ask. We start with a very specific request. Find all UnitedHealthcare patients with expired contracts on the Platinum and Comprehensive tiers, ordered by expiration date ascending. This is exactly the kind of multi-condition filter that would normally require a data analyst and a waiting queue. Watch as the agent immediately begins analyzing the request, constructs the SQL query in real time, and executes it against the live database. The results come back in seconds. The agent surfaces 5 patients with expired UnitedHealthcare contracts on the Comprehensive tier, noting that no Platinum tier contracts were found in an expired state. The results are ordered chronologically, from Sergio Gutierrez, whose contract expired back in March 2023, all the way through to Eduardo Chavez in July 2025. The agent also flags something important. Several of these contracts still show an active status despite having passed their expiration date, a data quality signal that may require administrative review. Now the conversation gets more granular. Rather than starting a new search, the user simply follows up within the same session. Show the services in the latest contract for Sandra Sanchez, one of the patients in the results. The agent understands the context. It already knows who Sandra Sanchez is from the previous query, and immediately builds a new SQL query to retrieve her full contract details. Sandra's latest contract is currently active from March 2026 through March 2027 and includes 11 services in total. 5 of those are core services, always covered regardless of tier, including annual wellness exam, comprehensive lab panel, emergency room visit, immunizations, and primary care visit. The remaining 6 are extra services she has chosen to add: home health visit, neurology consultation, occupational therapy session, psychiatry consultation, telehealth visit, and X-ray. With a clear picture of what Sandra currently has, the next question becomes, what is she missing? The user asks the agent to list all extra services Sandra does not subscribe to, ordered by copay from lowest to highest, essentially mapping out the full coverage opportunity. Again, the agent reasons through the query, joining her contract data against the complete service catalog to find the gaps. The answer is comprehensive. Sandra is currently not subscribed to 14 additional extra services, starting from the lowest copay: dental preventive care at no cost, vision exam and eyewear at $20, psychotherapy session at $30, physical therapy at $35, up through a range of specialist consultations at $50 each, echocardiogram at $60, urgent care visit at $75, CT scan at $80, an MRI scan at the top of the list at $100. This is a fully ranked, actionable list of services available to her under the plan that she has not yet enrolled in. Here's where the demo steps into genuinely powerful territory. The user issues a single, multi-part instruction: prepare a new contract for Sandra, extend her existing extra services by the 2 with the lowest copay, and generate a new contract document, effective March 1st, 2026. This is not a query. This is an action. The agent enters its planning phase, reasoning through exactly which services to add, how to preserve her existing 6 extras, and how to correctly structure the contract creation call. Watch the agent work through its own reasoning transparently. It identifies the 2 lowest copay unsubscribed services: dental preventive care at $0 and vision exam and eyewear at $20, maps them against Sandra's existing service IDs, and assembles the complete list of 8 extra services her new contract will include. It then executes 2 tools in sequence: first staging the contract data, then calling the contract document generation tool, which runs one by one through its staged process. The contract is created. A new record has been issued for Sandra Sanchez on the comprehensive tier, effective March 1st, 2026 through March 1st, 2027. Her coverage now includes 5 core services and 8 extra services, the original 6 plus the 2 newly added. A PDF contract document has been generated and is ready for immediate download. The generated PDF is a fully structured health insurance contract document. It captures all contract details, Sandra's full member information, her insurance provider and group number, the complete list of covered core and extra services with copay amounts, and all standard legal terms including termination clauses, HIPAA privacy protections, and governing law. The document closes with a signature block, ready for both the member and the authorized representative. From a targeted patient search to a detailed service review to identifying coverage gaps to generating a signed-ready contract document. This entire workflow was completed through natural language in a single conversation, with no manual data pulling, no spreadsheets, and no back and forth with a data team. This is Snowflake Intelligence, powered by Snowstack.